I'm Laura Wood. I'm an oncology nurse at the Cleveland Clinic Cancer Center, and I'd like to share with you on this episode some information about how checkpoint inhibitors work in fighting cancer. It's important to understand how the drugs work because that really falls into providing you information and your practitioners information on what side effects you may be experiencing. So the immune system is a network of cells and tissues, including lymph nodes, that help the body recognize foreign substances such as bacteria, viruses, and cancer. What happens with cancer is that the cancer cells find ways of hiding from the immune system. So they're not recognized, they're not destroyed, and they find ways of disabling the immune system. And that's how they are able to hide and undergo replication and dividing and metastasis without being recognized and destroyed. So there's a class of drugs that have been developed that are immunotherapy drugs. They are referred to specifically as checkpoint inhibitor drugs that help reactivate and engage the immune system to fight cancers. What they do is that they either release and help the immune cells multiply and are released, and other drugs help the immune cells recognize the cancer cells. Currently, there are 3 different checkpoint inhibitors that are FDA approved in a variety of different types of cancers. And what you'll see on this first slide is the list of the drugs. You'll see the first column includes the generic name for each of these drugs. The trade name is in the second column, so every drug that's available has a generic name and a trade name. The 3rd, 4th, and 5th columns show what target of the immune system each of those drugs interacts with. So atezolizumab, avelumab, durvalumab block PD-L1. Ipilimumab blocks CTLA-4. And then nivolumab and pembrolizumab block PD-1. So we have these drugs now available. There are more drugs in clinical trials, but these are drugs called checkpoint inhibitors that can be used by themselves or in combination in treating cancer. What this next slide shows is where visually each of these work. So you have an antigen presenting cell, and that monoclonal antibody ipilimumab interferes with the ability of that antigen presenting cell to engage with the T cell. And so blocking that allows the T cell to multiply and impact the ability of the immune system. The lower graphic then shows where PD-1 and PD-L1 are, where PD-1 is on the activated T cell, and PD-L1, such as atezolizumab, avelumab, and durvalumab, are on the tumor cell. So they block the cancer cell's ability to hide by activating either the T cell or activating the tumor cell. So immunotherapy drugs can be given by themselves, or they can be combined with other immune therapy drugs. So you've got checkpoint inhibitors plus checkpoint inhibitors. You have checkpoint inhibitors plus chemotherapy, or checkpoint inhibitors plus targeted therapy. Your oncology team will provide you with detailed information on what your actual treatment regimen involves, how those drugs work together to be more effective in treating your cancer, and what the possible side effects are of each of those drugs. It's important to write down your questions. It's important to communicate with your oncology team, both with the questions you have. You need to be a vital part of the team. Understanding your treatment, knowing what side effects to be aware of, is an integral in being part of that team. We're not at your home. We don't know what questions you have when you're not in an infusion chair in clinic, and we don't know when side effects are developing. So it's critically important that you write down your questions, you get those questions answered, and you communicate with your team as side effects begin to develop. I hope this information has been helpful. Please feel free to communicate with your oncology team. You're not bothering us, you're not interrupting us, you're being part of a team in treating your cancer. So I hope you found this to be helpful, and thank you so much for your time.